Okay, okay. Okay, it's like saying it doesn't want me to type like that, so I gotta go back, yeah, okay. Space. Yeah. Yeah, no, I'm not, just a moment. Yeah, I'm typing it. Yeah, take that out because I cannot see. I don't know why that, okay. No, this one that says add a, okay, okay. Okay, I'm done. Okay, I'm done. Okay. Okay, good afternoon, Harlem. This is Terri Wisdom coming live from Harlem Network News. It's a great day in Harlem, as is every day in Harlem. It's been quite a journey here in Harlem. As those of you who are just joining, I'd like you to know that Harlem Network News is a new media platform that was created to ensure that Harlem and Harlems of the world are informed. We cover events and information that major media is not covering, so it's very critical what we're doing, and of course, knowledge is power. I would like to move right on along because today we're talking about what's going on in Harlem. We have our Congressman Adriano Espaillat with us from our great 13th district. We also have Athena Moore, who is the Chief of Staff for the Borough President of Manhattan. And we have some other public officials that are trying to join us. Everybody has just been so busy and overwhelmed. And we will also have our medical minutes doctor, Dr. Jaquita Agby, join us shortly. So without further ado, I would like to have Congressman Espaillat come on. We know much has been going on in Congress, and he's got meetings after this, and he's got to get back to Washington. So Congressman Espaillat, can you just tell us, your community, what's happening from your perspective and what the read is on everything that's going on? Because we're hearing it in Congress, we're hearing about the Senate, but we need clarity, and we trust and know that you represent us. So thank you.
Thank you, Terry and Harlem Network News for allowing me to speak to the community via this venue. I think it's important you have played a pivotal role, particularly during the pandemic, informing not just folks in Harlem, but throughout the country, I would say, on the important things and things that they need to do, what they need to watch out for. And so I thank you for this opportunity. Right now, we're at an impasse in Washington. As you know, several months ago, we passed the HEROES Act. The HEROES Act was a $3 trillion piece of legislation that included in it $100 billion for rental assistance. That's critical for our community. As I walk throughout the community, I'm being stopped by my constituents that are concerned about where they're going to get their rent money. And some of them are backed up 2-3 months. And of course, although the moratorium has been extended, that there's no evictions happening yet, people are concerned. And so there's $100 billion in that HEROES Act that would address rental assistance. And I think that's very important. In addition to that, the big debate has been around the $600 for the unemployment benefits. As you know, our New Yorkers are able to get up to $500 from the state and up to $600 from the federal government for unemployment benefits. So the federal government continues to provide this until last night when it expired. So people are worried about that. We have included the Democrats in the House and the HEROES Act. We've included the $600 through December. We feel very strongly that we should not push people to go out and expose themselves as the pandemic continues to ravage across the country. In addition to that, the stimulus check in the HEROES Act is $1,200 for parent adults, as well as $1,200 for children, up to $6,000. And so that's another point of conflict with the Senate. And we're waiting on the Senate and the White House as they negotiate to approve these measures. I think they're important. And lastly, I think with regards to the HEROES Act, Terry, state and local government funding. We pushed in the HEROES Act provisions to allow for state and local governments to get funding. As you know, the revenue has been dramatically down. And if we don't do that, then we're going to witness severe cuts at the city and state level to very important programs that are dear and near to all of us. So those are basically this increase in SNAP, which is food stamps, and we also are asking for additional funding for small businesses. So there's lots in the HEROES Act, and we would like to see that piece of legislation approved by the Senate and signed into law.
Okay, so because I know that they're at an impasse, and the last time we had you on, which was a while ago, the HEROES Act had just been introduced, and all this time has passed, and they really have just started to coordinate what is going to happen. And I know that we have been hearing that the Senate would, allow $200, not $600. We've heard the chair, Nancy Pelosi, saying that's not enough. So when these impasses happen, because it feels like everybody's life is in the hands of the impasse, what is Congress doing? What are you able to do? Where are we with this circumstance? And we as citizens and voters and taxpayers, what can we do to help and support and move this forward?
Well, we're putting the pressure on the Senate and the White House. We saw the president go golfing as the $600 expire. Now that's gonna kick in next week. So we're looking to go back to Washington this week, and hopefully we'll have an agreement. But we're pushing hard for the $600. I think that's not a lot of money. People have bills to pay, and it's really not a lot to with the cost of living being what it is in New York City and across the country. And so we're pushing for that. And the rental assistance is one that I personally and Congressman Chuy Garcia from Illinois, Chicago, Illinois, we push for those $100 billion. There's also monies there for the subway system. We can't really open up unless we have reliable public transportation. That was $3.8 billion that I helped put in the HEROES Act. So we're pushing for each and every one of these provisions in the HEROES Act. But the Senate sat on their hands and has not done anything. This is the time to act. The public should put pressure on the Senate and the White House to pass the HEROES Act today. As the $600 expire, we're going to see people next week and the following weeks hit hard times. So we want that to be adopted immediately. That's the push that we're making, and that's the call that we're making on our constituents to ensure that their voices are heard, that the $600 and the $100 billion for rental assistance must be passed.
Okay, so just for clarity, when we speak about the rental assistance, because to my understanding, and I want everyone that is in our Harlem ears, Harlem the World ears, to be clear, there was something that came out that had
Out of the
a
state.
deadline that was just for our state, I believe.
That's
where,
correct.
People had to fill out the form. So if you would just elaborate on that, because for just citizens that are not sitting in Congress and lobbying, it may be a little confusing. So when you're talking about rent and the federal government, would you just elaborate on what's happening in the state? And I believe that they extended that deadline past the 30th as well. And
that's correct. That deadline has been extended, I believe, to the 9th, if I'm not mistaken. But that's federal dollars that came in through the CARES Act. When we passed the CARES Act very early during the pandemic, that funding came to the state and is $100 million that is now part of this rental assistance program from the state.
I see.
But we're talking about $100 billion for the country. And so that will take care of this issue. I believe that that's enough money that it will help dramatically help tenants that are backed up in their rent. And so whereas I encourage folks to apply for the $100 million rental assistance that the state is offering through the CARES Act money that came through the federal government, through Washington, through us, I ask people to continue to put the pressure on the White House and the Senate to pass the HEROES Act, the provisions in the HEROES Act that include rental assistance for $100 billion.
Okay, so that gives us a little clarity, because we have been bombarded with so much information, and some of it is confusing, and obviously there are forms to fill out, and some of the circumstances that everything has to be done on a computer. And there are some people that either don't have a computer, don't have Wi-Fi, or even if they do, they're working on their computer skills. So, but that's an aside.
If you have issues of filling out the application, there are organizations across the community, Palante Harlem, and further uptown is Northern Manhattan Improvement Corporation, the Northwest Bronx Clergy Group. Also, they can assist you with filling out this. I know that the application process was a little bit complicated, and in fact, the platform the first day collapsed because there were so many people that try to access the funding. But as you said earlier, the period has been extended.
Okay, so that's great. So once we get through this state period, the other funds that you're talking about for rental assistance, are those coming through the HEROES Act?
That's correct.
Okay, those are coming through the HEROES. And then the moratorium on eviction, what impact does the federal government have on that versus the state? Who determines that?
Well, the state courts, housing courts are mandated by the state, and the governor has extended the moratorium. So no eviction, although I hear that landlords are still pushing to get people out. No one should leave their apartments. No, they should be bullied out of their apartments. There is a moratorium that forbids that from happening right now, and we will continue to provide legal services through the non-for-profits in the community, the Legal Aid Society, and others that are there to provide assistance to tenants that are being pushed out. I also wanted to share with you, Terri, some of the things that I'm going to be doing in the district during the weeks of August. We're going to be
great. Thank you.
We're going to be distributing masks as we still need to protect ourselves. Just because the numbers are dramatically down and we're happy about that doesn't mean that you should let your guards down. So we're going to be at 116th Street on the 5th with the African community there. We will be also that same date in Northern Manhattan with NIMIC. On the 7th, we will be at Montefiore, the hospital in the Bronx, with a food pantry there. On August 11th, we will have a transportation roundtable to discuss the status of the 2nd Avenue, the extension of the 2nd Avenue subway through Harlem. And that will be online, and we will notify all of you for that. Also very important, and I welcome you to participate on the 12th, August 12th, we're gonna have a virtual tribute to the great John Lewis. And that's gonna be in collaboration with the Abyssinian Baptist Church. Excellent. And other churches in Harlem. So we will ask for you to participate if you can in this legendary and historic tribute to the great and late Congressman John Lewis. And of course, we will be also on the 13th distributing some masks, August 13th in the Bronx. So we'll let you know of additional items that we'll have on our agenda. Also this coming week, I will be doing some robocalls for census. We will be contacting residents in zip codes that we feel the numbers are low, and we will be doing robocalls, asking them to fill out, encouraging them and reminding them to fill out the census form. As you know, the White House is attempting to cut short the census period by 1 month, and that will dramatically impact our count, and it will almost guarantee a severe undercount, particularly for hard to count communities like some of the communities in the 13th district. So this week, Harlem, East Harlem, and other communities that I see have very low numbers will be getting robocalls from me, encouraging them to fill out the census form.
Okay, are there any, and I'm gonna segue to you a little bit, Athena, because this may be more of your area. I know that our borough president, Gail Brewer, I think they had a date where we were gonna walk and help, get this census going, but I wanted to find out if there are any spots or locations where people can actually come and fill out the census. I know it's a pretty short form, but if it's online, it may be difficult. Did you want to chime in? And this is our chief of staff from the borough president's office, Athena Moore, representing our honorable Gail Brewer. And then we're going to get right back to you. And thank you so much, Congressman, for really covering a lot of these key points. I appreciate it. Okay, so Athena.
Thank you. Thank you so much, Terry, always for having us at Harlem Network News and to join the Congressman. Yes, we've been very actively promoting the census, working collectively with groups here in Central Harlem, but also Washington Heights and East Harlem and the rest of the borough. We actually just completed a Harlem caravan, which kicked off about 20 cars who rode around Harlem to various hotspots. And some of those hotspots, we created pop-up sites, pop-up locations, which were also operating this weekend and will continue to be accessible to those who need to fill out the census. Some of those hotspots were the David Dinkins Gardens, the Fred Samuels Democratic Club on 135th Street. We had those joining us at some of the churches. We certainly had those at Silicon Harlem, which is one of our technology hubs. Dunbar Houses, further up in Northern Manhattan. We also are continuing to have the Wyatt T. Walker Senior Housing on 116th Street as one of the pop-up sites that are available to help individuals, and so many more. But we continue to promote this both online as well as to tell people it's 9 questions. They can complete it at uscensus.gov. And if they need any assistance, come to a pop-up site or to our office on 125th Street. All of us are happy to help.
Okay, thank you. Did you have any more comments in terms of what our Congressman Espaillat had to say regarding rent or any of the other things that are directly impactful to the community?
Yes, I definitely wanted to support the Congressman's remarks around the relief funds, the rent relief subsidy funds. The deadline is August 6th. It's been extended to August 6th.
Okay, thank you.
And we are helping folks to complete those applications. We've been giving out our constituent services number. I know the Congressman's office is also helping, and the Assembly members as well. You can call us at 212-531-1609, and we will walk you through the process. The HCR, which is the Housing Community Renewal Agency, is the state entity that has oversight for this process, and they've been very accessible in utilizing us elected officials and providing assistance to our constituents. So we encourage those to sign up. It's not too late, and they've actually extended time for those who are disabled a little further beyond the August 6th deadline.
Mm-hmm. Okay.
Yes, and
yes, go right ahead, Congressman. Thank you.
Terry, also with regards to the census, in each and every one of those activities that we're having in August, we will be conducting census work as well, filling out the applications for anybody that has not done so. It's important that we put our full court pressure on this effort right now to ensure that we get as many people as possible accounted. Also, want to remind folks, small businesses, that the PPP program, which helped close to 6,000 businesses in the district and helped preserve 33,000 jobs, that's still available. There's still money there. You can still apply until the 9th, I believe it is. And so you still have this week and a little bit of next week to apply for the PPP program. There's still money in there, so don't be shy. And if you haven't done so, I ran into some of the business owners that have said that they need help, and then I've asked them, have you applied? And they say, no, it's like the lotto. You can't win it unless you buy the ticket. You gotta be able to apply. And so I encourage everyone to do so as well.
Okay, and
Terry?
Yes.
Yes, I just wanted to add one thing to that, because the Congressman reminded me that in terms of census, the creativity of our community is at its best right now in terms of getting that word out. So far that we've actually done a fortune cookie census initiative, as you could imagine.
Wow.
For those in Lower Manhattan, and I think just as well in Northern Manhattan. We've been using our creativity and our arts and culture to make sure this message goes wide. But lastly, on the point of funding, Congressman, you mentioned the PPP and the federal relief funds. But we also have to keep spreading the message that there are grants available.
That's correct.
That are not loans, and that people still need to pursue those. The borough president, at a very small level, but trying to reach as many as possible, just announced her Manhattan Community Grants program that happens annually. And I know each of the electeds will have their own, fair share of discretionary funds, etc. But this announcement was made this week. So I want to make sure people know to go to the borough president's website and apply for local grants that support. And our focus will not only be on food distribution efforts, but also efforts like racial justice and arts programming and community police relations, which are not things that others are gonna fund. So we can talk about that further, but I didn't want to forget to make mention of that.
Okay, this is all phenomenal. And for those of you who just tuned in, this is Harlem Network News, and I am your host, Terri Wisdom. And Harlem Network News is a new media platform here in Harlem, and we are dedicated to ensure that Harlem and Harlems of the world are completely informed. We know that knowledge is power, and just in these few minutes with our congressman and our representative from the Honorable Gail Brewer Borough President's Office, look at the wealth of information. We are going to make sure that follow up in the chat. We'll just have to do a list of all of the things that are coming up, because they're all critical. And we know that in this time of COVID and transition, everyone is overwhelmed, but it's very, very important that we meet these deadlines, that we fill out these PPEs. As you said, if you're not in it, you can't win it. And we have to really take this time of COVID as a time of hope, a time of faith, a time of really just taking the situation and making it work for us. And obviously we are a resilient people, and we're a people that we've been doing that anyway. We've had to. So we need to take what's become available during this COVID time, the grants. Is there a deadline on the Borough President's grant, Athena?
Yes, the deadline is August 21st at 5 p.m. And it's a one-time contract up to $7,500.
Okay, up and I'm sorry, I lost the last part of it.
$5,000 to $7,500 for each grant.
Okay, excellent, excellent, excellent. And we're going to come to you. We do have our Dr. Jaquita Agby here with us now that does our medical moments. So we will come to you shortly. Congressman Espaillat.
Thank you for having me.
I had
sorry I have to leave.
Okay, had one more question for you.
Go ahead, go ahead.
With the disaster relief, because I know there's the PPE and the disaster relief, I have encountered some businesses that have said that they didn't get any follow-up from the disaster relief people. They got an initial grant, and there's supposed to be some kind of portal, and they haven't gotten that information. So they have reached out to the disaster relief people and who responded. So there may be some degree of breakdown in that situation. So I just wanted
Well, let me, they can call my office at 212-663-3900, and we will get back to them. And if they can give us the individual information, we'll follow through and figure out what's going on.
Okay, all right. And I thank you so much, Congressman.
Thank you. I'm sorry I won't stay for Dr. Agby.
It's okay. We always keep everything up on Facebook, so you'll get to look into it. And next week or during this week, we want to just salute everybody here in Harlem. The Black Lives Matter mural, and just no matter who tried to damage it, it got fixed. They had a wonderful culminating event that was on Friday. It was just amazing, healing. They had Beyonce's lead dancers. I think they did a music video. I mean, they really went all the way. And I have some great pictures of all of you elected officials, and I'm going to make sure that you get them. And we're going to just work collectively. And I will let you go because I know you got to go to Washington. I know that you have a next meeting, and whatever we can do, because I feel as citizens, congresspeople, senators, elected officials, we must hold our president, Trump, to task. He must be accountable. So whatever creatively it is that we can do as citizens, he's got to be accountable.
Thank you, Terry. Just keep the pressure on. Thank you so much all for having me. Have a good one.
Okay, have a blessed day, safe journey.
Bye-bye.
And we'll stay connected. And thanks to your staff.
Thank you.
As are you. Okay, be safe, and we got your back. Okay, thank you so much. Okay, so Dr. Agby, we just went over many of the things that are happening in the federal government, in the city government right now. And there are many deadlines. We've had rental assistance deadline that's extended. Our Congressman Espaillat and all the other great Congress people are just really pushing to get this HERO Act passed. But if you could share, because all of this, good and bad, has come out of this COVID-19 pandemic. So would you give us like a view from a medical perspective where we are, from a social, cultural perspective where we are? And then we'll segue back to you, Athena, just in terms of the test and trace and, you know, our phase 4 and so on and so forth, and just how we're doing and what we're doing. Dr. Agnew.
Right. So, so the trend that I'm seeing, obviously, because there's more testing being done, we're seeing that more people are testing positive for COVID. But I feel like there's a lot of hope. I had just watched a video where doctors that are on the front line were, making a plea to the American public that, things are not as dire as they seem. Even though people are getting it, they seem to be managing it better. And they're learning more about the virus and how to manage the complications to some degree. They're learning more. I was just speaking to one of my colleagues who also, she actually teaches and things like that. She's an educator. Her mom had contracted COVID and was in the ICU with pneumonia. Things are looking bad, but I was asking her about the protocol. What are they doing? They seem to be having I'm not in the hospital all the time like that, so I'm not sure. Depending on the hospital, they can have different protocols, but it seems like they're reaching some type of standard. Just ensuring that when patient comes in, checking the dehydration status, giving fluids and vitamins within the bag, and also using the antibiotic and hydroxychloroquine, and of course oxygen. So her mom was about 65 years old. Things didn't seem like they were going to turn in a favorable way, but she actually was able to be released, and they were able to treat the pneumonia pretty well. It doesn't mean that I'm not saying that we shouldn't continue to take precautions, but what I'm saying is that we are the doctors and the people in the medical field have they're trying to really get a strong hold in the treatment process for this virus.
Right.
While we're waiting on a vaccine, yeah.
Okay, so you've raised something that I think is extremely critical, and it has been a lot of confusion to people, because the whole impact of hydroxychloroquine, I think it is, and the antibiotics and what the treatment is. We all are at this point on social media. This is Harlem Network News for those of you who are just tuning in. And if you're not tuning in now, you will be able to see this after on our Facebook Live. We try to keep things up, or on our YouTube. But HarlemNetworkNews.com, you can go to for articles and also to give us the support that we need. But I wanted to get some clarity, because there was a doctor, and I believe that she was Nigerian. I don't have her name in front of me, but she went viral on social media, and she was saying that I am treating, patients with hydroxychloroquine and with antibiotics, and these patients are getting better, these patients are living. And then she was actually on major media, and it was said that this is a woman that the President Donald Trump was supporting what she was saying. But then we heard Dr. Fauci, and that team all saying that this hydroxychloroquine, that doesn't work, it's not effective. And is that the same drug that President Trump was talking about? So I as a media person, as a journalist, and as a citizen, I'm confused. So
it is. I mean, see, I mentioned that, and I really didn't want to. It just came out.
Okay.
Because I know it is a controversy behind it. I wouldn't use it. I wouldn't use hydroxychloroquine unless it's absolutely necessary. Like in that situation with that patient, the age, the fact that she contracted pneumonia, that's a case that I would want to use that drug. To be honest,
or not?
I would want to, because I'd rather have. It's a life over death situation in that situation. So it's like, give her. If we know it has potential to work, then I'd rather give it than not. But I'm not saying it's something, a standard that every patient should have.
Right.
But if you know that it could work in terms of treating the pneumonia, then go ahead in that specific patient. So I'm not making a global statement for everybody to go run out, and that's what the president did. And people were using the animal version of hydroxychloroquine, the stuff they found in their cabinet. I'm not saying that by any means. I'm just saying
Right.
it seems like they are, because they've been treating it, right? We were seeing that hospitals were becoming saturated. So they've been having more and more experience in reference to COVID cases. And of course, it's not never isolated. In the medical community, it really is a community, and it's a sharing of ideas and treatment protocols. So that I'm just saying that it seems like they're having more of a handle, but the American public still has to do their part. That doesn't mean you could be reckless. And they were also everything is confusing, because there was another doctor reporting that someone had said someone close to him had contracted COVID, and I guess a tracer called. And he's like, well, what, do you have any symptoms? He said, well, I have this. He said, okay, so it looks like you're positive for COVID. And so now it looks like for him, he's tested positive for COVID. He never got tested though.
Okay.
This is just based on a phone call, a contract tracing.
Right.
So we don't even know if the numbers honestly are skewed or not. Like this, we don't know what works and don't work all the way, but there's certain things that may work in terms of therapy, pharmacotherapy. So that's all.
And the hydroxychloroquine, just for clarification, I know that you were a doctor of pharmacy. Is that the drug or the medicine that they have been using for many years to cure malaria? Is that the same drug?
Yeah, it's used for prevention and treatment of malaria. It's an anti-malarial drug. It does have some toxicity things. That's why I'm not a fan of it. It does cause like visual disturbances and things like that. So it's not something that I would want to use off the bat, unless you have to. That's what I was saying about it, because of its side effect profile. But I mean, if the numbers are correct, it looks like it's definitely just sweeping its way around, and there's a potential for a lot of people to contract COVID at this point. It's a reality. It's a reality, and we're shifting. Obviously, we all know what's happening. We're shifting into a new reality because of this virus. And you guys were mentioning grants and being creative. Just because things are shifting doesn't mean that money's not out there. It's just ways of being creative enough to find where the money is flowing, so that you can not, how do I say this? So not go under the water in the midst of this pandemic. Financially.
Okay. Yeah. Well, thank you for sharing, because obviously our health and our medicine and our businesses and all of those things, they cross and they impact us. And I know that this is Harlem Network News for those of you who are just joining, but I also know that it really has been stated that people of color, their circumstance with disparities and lack of services and lack of economics has actually put them in a status for poorer health because of the stress factor of dealing with all
because we weren't ready. How do you say this? We weren't ready. If you are, there was a couple of factors that the medical community was considering. They were looking at how this virus attacks the cells, right? And what they saw was in relation to other races, we seem to have a very specific, there's a specific receptor that this virus likes to attack. And we actually have a lot of upregulation, meaning we have more receptors in our body that the virus has affinity to. And so that makes us more prone, in addition to having these underlying issues, which we talked about before. It's really about a health situation. It's really about taking ownership, right? Because we can blame all day, but taking ownership of your health and what you put in your body and how you're taking care of your body. So if you are not ready, because you have not been preparing, your body for instances like this is what's going to happen. And if we're not setting up frameworks, because I feel like this realm that we're in, this transition, it's really of the mind and technology. So if you have a creative mind combined with the technology, you can find ways to source money. You can find ways. It's available. But if you weren't ready, then this is the disadvantage of not being prepared. So I think that's really what we're facing in our community. And I think we have to take ownership we definitely have to start taking ownership. Yes, there has been many systematic or systemic things that have placed us where we are, but we also have to take ownership, crime against our own selves, right? Destroying our own communities. We have to look and enlighten ourselves and see how we are contributing to where we are right now. I really think that's time to look within for our community. We can't keep blaming.
It's definitely been a time of awakening. And as we're talking about these medical aspects, Athena, would you like to just elaborate on where we are with the different phases of opening, and also where we are with the test and tracing, particularly in Manhattan, because I know you all are with the Manhattan Borough President's Office, as well as specifically the Harlem. How are we doing? How are the numbers? What are the reports?
Yes.
Yes.
Sure. Thank you, Terry, and always good to see you, Dr. Ackley, again. So, as of the end of this week, I know for Manhattan that we were at 30,000 cases, according to the city's
I'm sorry,
weekly.
not to interrupt you. We just lost your video. I'm not sure why, but continue. This is Athena Moore, the Borough President's Office, and tech person, Sunny, we just lost. Okay, here you are. That's what we do.
That's okay, man. So of course, I know we were over 30,000 in cases in terms of the weekly COVID-19 tracker that the city puts out. And for New York City as a whole, that we were over 200,000. It was at 224,000 cases, and over 300 new cases citywide a day. And this is a continuing concern for everybody, because we know as the city continues its efforts to reopen, all the precautions are continuing to be urged for the community. We see more reopenings for the restaurants. We definitely have them underway. We're in streets now. We're seeing more and more crackdown. You saw from the governor and others saying that they will continue to give violations to those who do not adhere to social distancing rules, and how serious that is, as they're trying to discourage overcrowding at different restaurants. While we want to support businesses, we want them to continue to open safely. And we've also seen that there's been more opening of nail salons and barbershops and local retail businesses that weren't open in the earlier phases of the pandemic. And all of that has required us to be more vigilant with trying to encourage mask wearing, to continue to encourage good hygiene and washing of hands, but real strongly on the social distancing aspects. I know that the Assembly member has joined us, Al Taylor, and he's been right there alongside the borough president addressing these issues. So I'll defer if you want to get him in here, Terry.
Absolutely. And we're still having a little trouble seeing you, but we can hear you. And I very specifically want to know if either you, Athena of the Borough President's Office, or you, thank you so much for joining us, our Assembly member, Reverend Al Taylor, if you can let us know the impact of test and tracing, and if that is in fact working in Manhattan, and also particularly in Harlem, what the response has been and what our numbers look like. I know that today is, I think, the first day that we didn't have any fatality due to COVID in New York City, but what are our true numbers looking like, and how is the test and trace being impacted? Are people being receptive to it? Maybe we'll, if you could speak on it, Reverend Al Taylor.
Sure.
Yeah, or Athena, go ahead, either one.
No, I was only gonna start it out since he was getting himself situated, and just say that we've we've been among the electeds that have supported the various testing sites. And you know, the last time we were here, we talked about the launch of the Riverside Church testing site that we opened in partnership with Riverside Church and Dr. Thornton. And I know since the testing has expanded, and I'm sure the Assembly member will talk about that work up in the polo grounds. But what I wanted to say is that we've tested over 2,000 individuals at that site alone within 5 weeks. And so we know that the need is still great, and people are still coming out to be tested for both the antibodies as well as to determine if they have the disease. We'd like to continue to encourage those to come out. We have a list on our website of all of the testing sites that we're aware of,
Right.
and folks should continue to access them. So, Assembly member, did you want to add about the testing trace core or other dynamics?
Yes, thank you, Reverend Al Taylor. We appreciate all of you. I applaud all of you. Dr. Agnew, yes. You're muted.
You're still muted.
Reverend, you're still muted. Unmute yourself.
There we go. I'm in there.
Okay.
Let me repeat myself. I said the sisters are doing it well this afternoon.
Okay.
I'm in great space. Blessings and peace to you all. I think Sister Athena, you said it all. I can't give you any additional information on the contact tracing because it hasn't landed on my page yet. I'm not tracking it yet. I haven't gotten that information, but certainly to her point, the folks are still coming out to be tested. We've just wrapped up the Polo Grounds and Rango House for the whole month of July. We will be opening up in the North Community Room of Esplanade Gardens on Monday. And it'll be Monday and Thursday there. My office is also reopening, the district office, on Monday, Wednesday, and Friday, 10 to 4 by appointment only. I'm just happy I could jump on. And I was trying to get there, and after service, I stashed my backpack, and then I realized I didn't have my apparatus to get on. So
Okay.
I'm seeing your text, and I'm rushing to get there. I'm sweating like I robbed somebody.
Yeah, thank you.
Good afternoon, everyone.
Okay, so if you'd like to share, we'll get back to the test and trace issue, because I think that is an area that we've got to really track and assure. I know that if people are tested and they test positive, it goes straight to the health department, and then the health department is able to reach out. But in every aspect, in every area of what's happening in our community, it's imperative that we stay vigilant. And once again, I just applaud all of our public officials and the Village of Harlem for everybody has just been really amazing and showing what we're made of, and that Harlem is truly the Mecca of the world for African Americans. Harlem is the Mecca. Yes. So
Yes.
do you want to share a little bit, Reverend Al Taylor, Assembly member, Reverend Al Taylor, I want to get it right.
No, listen, it's not wrong. Look, call me Hey You. I don't trip over that stuff, because before I got there, I was my mother's son, and when I die, I will be my mother's son. And the work is what it is. I don't like, hey, you know, some of the people in the legislative body, they're like, well, we have to call you Mrs. Hill. I said, listen, I don't want to get you in trouble, but call me whatever they tell you. But I don't rock for that, you know.
Okay. Well, thank you.
And I modeled that after Denny. I worked for Denny for over 25 years, and he said, call me Denny. Not
okay,
Mr.
and let everybody know when you say Denny, who are you referring to?
I'm referring to the late, in my world, great Herman D. Farrell Jr. He was an assemblyman for over 42 years. He was chair of banks. He was also chair of Ways and Means. He was never one that got his nose in dirtiness or anything like that. He didn't play party politics in the sense. His thing was do the work. People will always come around the issue, whether or not they agree with you at different times. The issue will always bring people to the table. And I think that's why we're here on this Harlem afternoon talking with you, because it's about the issues. Everything else is not relevant. Issues. What do we need to do to transform our lives and the people in our communities? I want to share, and tonight will be our 4th night walking out. We started the Peace Walk, which is a relaunch of something we did almost 8 years ago, walking through the community And we're going block by block through our neighborhoods, giving out PPE. So we have water, we have masks, we have hand sanitizer, we have voter registration forms, we have information regarding the census, how to contact us, and just having conversations, interrupting, engaging people. Last night we did, so the first night was the Polo Grounds, and it was really interesting. Polo Ground Rango House, we were in there. I said, we'll get in here, get out in an hour. 2.5 hours later, I was still in the Rango Polo Ground because you're talking to people. It's not a clock that says you have to get to the next block by such amount of time, but how many people can you engage in meaningful conversations? I don't know why Hennessy don't put more money back in our community, because our people is drinking more Hennessy than the law allow. Everybody got a Hennessy cup. I'm gonna keep it 100. You know, and when they see me, they don't know who I am.
That's true. Hennessy has to give back.
And then they try to hide. I said, it's okay. It's just your early communion. I got it. But the idea is to talk to people in the spaces that they're in, hear what they're feeling, whatever's going on. It's just been wonderful. So the first night we were joined by Coach Dave from, oh goodness, The Dreamers. We were joined by Isha Say Cool and Street Corner Resources. We had Philip from the Public Advocate's Office out there. And the idea was, we don't want a bunch of folks that bring cameras and all that stuff. We just want people to, like, come on and hang out for a little bit. Just hang out. Because people look different in front of a camera and they act different in front of a camera. And it's nothing like walking up on somebody and one guy, you know, he's smoking this no-brand cigarette and he's trying to hide it. And he's about to burn his fingers up. I said, my man, you're going to hurt yourself if you know. But it's the respect and courtesy that they give to each other when you're out there. Loving kindness. The second night, we were out on 145th, and tragically, a guy on an e-scooter runs over a Yorkie puppy. And we did our best to save that dog, but he died right there. Wow. And then it got a little hot, and we knew that in a minute, that grieving family was about to turn everything on that individual. And I want to say big shout out to Inspector Grinny at the 3-2. I hit him on his cell. I said, listen, it's going to get ugly real fast, real quick. And they were able to come and they talked, and we were there for about 45 minutes to an hour, and everything dissipated. They did take the individual in for a citation for riding on the sidewalk and to make sure he had no outstanding warrants. But me, I'm glad that they did that because I wanted to make sure he was safe. It was an accident. It was a stupid accident because he should not have been on the sidewalk with that. So if you know anybody out there that's in the business that would have a baby male Yorkie, it would be a blessing to give this family back one. I mean, it's just, it was heart-wrenching. It really was. Wow. I did everything to keep from crying. And then, you know, we went on to some of the other locations. And then last night we found ourselves, we started my campaign headquarters, and then we went over to Colonel Young Park. Everybody there is from everywhere but there. But I'm from Harlem over here. I'm from Sugar Hill over there. I'm from Brooklyn over there. I'm from the Bronx over there. But everybody, and when the officers, there weren't a lot of officers, but when they told the DJs it's time to bring it down, it ended. And we gave out over 200 masks that night, easy. Last night we finished at 10 instead of 11 because we ran out of supplies. Okay. That's how big the demand was. So that's what we're doing every night. We will do that every night until September 7th, period.
Commendable.
We're popping up everywhere, my staff and volunteers. We're having fun.
Okay. It's amazing, like I said, the way the Harlem community has shown up for everything. I mean, even in the wake of the Black Lives Matter mural being damaged like 2 times, the community really showed up, repainted it. There are philanthropic people in the community that sold artwork to help make it happen. So it is a great feeling of satisfaction and encouragement to know that the community stands behind you. So Reverend Al Taylor, can you let us know, you said every night you start at 8 o'clock and each night you're doing a different location?
Yes.
So if people want to support you, join you, donate, what do they need to do?
I'm not that smart. I don't deal with money. I tell them if they want to give money, talk to my treasurer or contact the church, infinityMidnightChurch.org. If people come at me that look like they're about to give me something, I run, I break out.
Okay.
I don't have any problem, but they're welcome to do that. If they want to find out where we're at, they can follow me on social media,
Okay.
Instagram, Facebook, Twitter. You can even call my phone. I don't care.
Okay.
Text me. Text me,
Okay.
646-418-8000. There it is.
Okay. Okay.
Yeah.
So, I mean, I just think this is great. And this is us helping us and getting on the ground and talking to the community. I mean, in one fall sweep, you, Reverend Al, and the team can talk to the community about stopping the violence with having Aisha Sekou, and she was on here last week with the Speak Corner, resources. You can talk about that. You can also talk about the census. You're talking about the COVID, talking about a lot of things when you're with the people. So it's invaluable work. Athena, do you want to chime in on some of the things that are going on? Because
Sure.
I think all our boots on the
Yeah,
ground.
thank you so much. I just want to chime in on the comment that the Assembly member made about us distributing masks. The borough president just distributed another 100,000 masks. Each time we get these donations, we started out with the hospitals and giving them the PPEs, and then we moved to NYCHA developments to make sure that they were being taken care of. And now we're working with a number of the cleanup efforts that are happening in Harlem. The 125th Street bid and the National Black Leadership Commission on Health and others are having a cleanup on August 4th, and we'll be out there giving out masks and supplies during that time, because it's going to be at block associations across the whole of Harlem, and so that will be significant. And then I was thinking about what the Assembly member said about the recent issues regarding violence and trying to prevent it in our communities. And we've been with him and the mayor, as well as the Pure Violence Group, like Aisha Sekou, in Central Harlem, but also in East Harlem with Save Harlem, one of the Pure Violence groups there. And we've been at the various rallies and marches. And when you mention the Black Lives Matter movement, we're so blessed that the borough president could be with the Uptown Harlem groups, painting the first time, repainting. We just donated gallons of paint to the repainting effort, but also that people are still using Foley Square, where we created the mural down there by the African burial ground, as a place to continue to protest and advocate for the things that we know are important in this social justice movement. So, we're just excited that this is a time we can be part of the change, that we can work collectively and be more unified, and also ourselves. We have to do more to police ourselves, and I think we're all stepping up to encourage that kind of responsibility from our community.
Yes.
So I think that there is so much invaluable information, and we're going to try to assure that we disseminate all of this information. We'll put it in the forms of articles, chats, really direct you to go to the newsletter that comes out every week for the Honorable Gail Brewer, our borough president, as well as the websites of all of the elected officials, because it's a lot of information, there are a lot of deadlines, and we've got to keep up. As you said, if you're not in it, you can't win it, and we're definitely about winning. So is there anything else, Reverend Al Taylor, that you'd like to share? Because I know there have been a lot going on. We are going to be meeting and speaking with our state senator, Brian Benjamin. I know he's pushed through some legislation. Our other honorable assembly member, Inez Dickens, was not able to join us today. And for those of you who are just coming on, our Congressman Adriano Espaillat just left. So if you'd just like to elaborate on some of these lawmaking things that are happening that impact us all, Reverend.
One, I think we have a dynamic group of folks that represent Harlem in terms of legislators, and I'm proud to work with each and every one of them. I know we've got a slew of bills that are in front of our housing committee in the assembly, and I'm sure there's the counterpart in the Senate with respect to rent relief and how we're going to get to the next step. The bad part is if we don't get federal aid, it's going to get ugly real quick in New York State. If we don't bring federal dollars in, it's going to get ugly. When I say ugly, that means we're going to have to do a lot of laying off. The city's going to have to do it. The state's going to have to do it. And we're already in a rut, if you would. So I think there has to be this balance of life and what's going on around you. So the people that are enjoying themselves out on the streets, we don't know how many people they lost, how many people they're grieving, what has happened during these bitter months that bring them to this point. So let people live as they can, as long as they're not hurting and disrespecting other people. I think that little bit of noise, and for my new gentrified folks into Harlem, it's just something we do. It's the history of Harlem. When it's hot, you don't have an air conditioner, you can't pay for an air conditioner. It's not uncommon to see people on the stoop. It's our culture. So let us not be alarmed that every group of people that are brown and black are not harmful. Some of them smoke weed, but some of those that are, praise the Lord, they smoked it too. They just don't remember now. There's been some decades. So I'm not making excuses or allotment for people that are doing those things, but I think we should approach it with a different mindset, because if you make it as a criminal and everybody, then only us are going to go to jail anyway. And it has been so sad so often that we don't know what the outcome will happen when we put our young people in front of law enforcement. And I think law enforcement has a tough job already, but we can't use them for mental illness. We can't use them for homelessness. We have to use them where it's appropriate, but we have to think outside of the box and see what public safety looks like when we're doing it for ourselves or within a community. So when we call them or look for them, they're doing a different role, as opposed to, you can tell that person, could you please bring that down and move over there? Would you consider that? You may get cursed out, or you may not, but try it if you feel safe. Or, you know, it's just communication, and we're losing it more and more, but I am hopeful. And again, I think we need to celebrate right now as much as we can from where we've been in the last couple of months to where we're at right now, and what the possibilities look like tomorrow. We don't know. Now I'm going to do the Reverend thing. Only God holds the future. So right now, he says, I'll never leave you nor forsake you. Greater is he that is in it. We need encouragement more than anything else. And we're not going to find it in mankind. It's going to come from a higher being. I got to put that out there. I know I'm elected to do legislation, but I can't control the world or what's in it. I can only do the role that God has given me to do. So I want people to be encouraged and look to your spiritual leader, your creator, whatever that looks like in your world. I know what I do, but you can't do this looking in the eyes of man. And sometimes they're jaded. They mean the best, but they're going to take care of themselves first, us for and no more. And we got to figure out how as a community, we're going to transform the lives around us. And I want to thank you, Sister Terri, for having this platform and always welcoming me here to be here. And I stopped preaching. I already preached this morning, but our hope is not predicated in what man is going to deliver. It's going to come from the Creator. And if you're looking at man, he's going to fail you. You're going to feel doom and gloom. I ain't got time for that, girl.
Yeah. Thank you. I mean, it's amazing, because things do come out of nowhere. One day we were in a norm, and the next day, and for those of you who have just tuned in, this is Harlem Network News, and I'm Terri Wisdom, your host. But one day things were normal, and the next day it was COVID, and stay in your house and wash your groceries. And, you know, so there's been a lot of evolution, but I do feel that the blessing of this evolution is that it has made us all get, as the young people say, it's made us stay woke, because we've had to, because it's in our face. And that part is a good thing. Though we can't get together like we normally did, we are coming together on these Zooms. And I feel like we're closer to our public officials and to some people in our community, because we can actually access you. And I cannot tell you how empowered and grateful I am that you and Athena Moore from the Borough President's Office will come on and speak to us directly and answer our questions. And also that the Honorable Gail Brewer, the Borough President, will come on, the Congressman comes on. I mean, how special is that, that our public officials, a Dr. Agby, I mean, people are touchable, and you can ask them questions. I mean, I still have, and I don't know if she's on now, and I'm going to resend it to you, but I can say these things. We have a wonderful childcare center, Sugar Babies. It is across from the Abyssinian Baptist Church. They have a beautiful yard. They've been doing gardening. you know, this institution, Sugar Babies, has been existing, I would say, about 15 years here in Harlem. I'm very familiar with them. My granddaughter, who is now a senior at Howard University, and other friends went and got a foundation with this particular Sugar Babies. They do an amazing job for our children. So Sugar Babies is just now reopening. They're having to meet all the deadlines and qualifications and cleanings. They cannot take all the children that they would normally take. It's a certain percentage that they can take. But Sugar Babies needs help and support to keep going. They've done the PPE, they've done certain things, but as business people, sometimes other loans are taken out to support, and they're new into this building, and they calculated on the fact that they were going to have a set amount of children, and they're not. So I will resend you the email, Athena, and to the borough president for Sugar Babies, and the executive director, Janae Shabazz of Sugar Babies, and anybody who is an essential worker who needs to send your child to an incredible child care center that's going to lay the foundation. It's Sugar Babies, and they take babies as well. And like I said, they have a beautiful lawn and, you know, play center private for the children right across from Abyssinia, and they're planting. They've done some planting with the community. So our community is touchable and is communicating. And the same goes this coming week. I am going to have the women from the Black Lives Matter Harlem mural Harlem Park. They will be coming on and they will be speaking. I'm also going to be having Dr. Iselma Fergus, who is the head of the cardiology department at Mount Sinai. And I don't remember what the term is, but her cardiology division is directed completely to people of color. That's what she does. And she's going to give us a report on how things look, and just the fact that people have gone to some of the home remedies and some of the preventions that is actually helping. So we have a lot to celebrate. We have a lot to look at, and there's just a lot of information that we have to assure. I don't know if any of you, the public officials, know what is happening with our post office, because we know that that is going to be impactful to the elections if we're having mail-in. Where are we with the postal service and what the president is doing? Then,
I don't have an answer for that, but I will tell you, if you ask and request and receive an absentee ballot, it's important that you sign the bottom of that envelope as you place your ballot in. If not, that ballot is void. I just put in legislation to correct that because it's relevant. Because if you get a ballot, if you live in New York State and you get a federal ballot, which means you get one because you're on some type of employment with the federal government or you're military, on the outside of the envelope, it reminds you of the steps that you need to do and ensure that you sign the bottom. If you're a resident in New York State and you're not federal and you're not military, those instructions are not on that envelope. And I've asked that they codify that, because we lose a third, close to a half of our ballots simply because the person failed to sign.
Okay.
I don't know about the post office. I didn't answer the question.
Okay, so it's very critical. And Athena, did you want to chime in on that?
Yeah, I would just, on the ballot situation, obviously we defer many of our inquiries about ballots to the Board of Elections, and we regularly, bridge people to that entity in case there are clarifications that are needed, and we're happy to do so if people call our office. And on the post office, we have, through our constituent services, been reaching out to United States Postal Office. We have intergovernmental liaisons that assist us regularly. So if we ever do have a concern, we're happy to bridge that. I don't know what the current status is, but I do know that we've been regularly reaching out for those, for example, who have not been able to access their packages or their mail. We are on the front of making sure that that happens. So.
Okay, so on that note, we have a lot of work to do. I believe we're doing the work. We have to continue. I continue in terms of the mayor and the task force that's on COVID and race to just say exactly where are we, how are things working, what is it we can do to support and to be a part. If you would like to address that, or Reverend.
I think the beauty of all of us is that we've been working so closely with electeds across the board, including the mayor during this pandemic.
Okay.
And one thing that I know has shown through is that whether we work with the Speaker of the City Council, Corey Johnson, or our local electeds like Council Member Mark Levine,
Yes.
or those like Mayor Bill de Blasio, and those who are seeking his position like Comptroller Scott Stringer and others.
Yes.
We've had the benefit of putting politics aside and just saying, let's focus on the work and how are we being in service collectively to the communities. So I know that Assemblymember Al Taylor joins me in that. It's been a blessing to just watch the collective work. And I do want to say that I encourage certainly all of our constituents to vote, to vote, to vote. I'm not here to say, you know, which way you should vote, but I do know that every vote matters. At this time, every vote matters.
Okay, so thank you very much. I'm going to let Dr. Jaquita Agby close us out as our medical moment person, as our millennium person. And Dr. Jaquita has been doing some incredible work with young people. Right now, it's concentrated, as you know, she is working in Florida as well as here in New York and doing online and virtual pharmacy. But she's working with a particular group of young people, some that have IEPs and so on and so forth. But if you would just share a little bit about the amazing work that you're doing and the education, because Dr. Agby, aside from being a doctor of pharmacy, is also an educator. And she has gone into the education world because she wants to make a difference. And she wants to show these young people, yes, you too can be a doctor. No matter what you grew up, where you grew up, you can do it. So if you want to share a little bit about the amazing tech work that you're doing with Maya Jones and what the name of the program is, so that we can look at doing some of that here, because it works. I've seen it in action.
Yeah, we're having fun. The premise of this summer program, and like you rightly said, this particular group of students, they have maybe learning disabilities, so they would have independent educational plans. And so they need a little extra help with things, but there's some brilliant minds within this. Some of them are so brilliant. And so the goal is, although it is a vocational camp, that's what it is. So we're teaching them about financial literacy. We're teaching them about how to find the pathways to your career and your future. But for me, the key is, and what I've learned later on, which is, you know, it's fine, as long as you learn it at some point, is that the first thing before you make any moves is important to unlock who you are, unlock your potential, realizing what your strengths are, what are you good at, where are your gifts, and the gifts lead you to your pathways, right? So we're doing a lot of internal work as well as the normalcy, but it's more a lot of internal work. And so we, myself and Miss Maya Jones, which happens to be the daughter of Miss Wisdom, we came up with a corporation called Create Tech, and which it's really STEAM driven, but so we have a lot of art. We are doing tutoring as well, and the sciences and math, so we can bridge that gap for these select children. And before the camp is about to end, but we're having a project, because I also write, in which I am allowing the children to express themselves and become writers. So to channel that inner author in them, There's also some children that are very good at drawing and painting. So it's a book, it has chapters, and each chapter has a theme. And there is a collective piece where everybody's bringing their particular thought on the topic. There's a chapter on serenity, finding that peace in the midst of turmoil. How do they find their peace? And offering inspiration to others. And we have other chapters. So every chapter, I write a little poem to show them something, and then they give me how they want to do it. So it's going to be a collective artwork, a collective book, which we're going to publish. And it's something that they can share and show off and inspire other children, right? So that's our project.
Okay, so thank you. And I think that internal work and that block by block that you're doing, Reverend Al Taylor, and what you, Athena, and our Honorable Borough President Gail Brewer doing, just hitting the streets for the census, the change is going to come from inside each person. It's not a mass change, but we've got to make that connection. And like I said, the COVID has in many ways been a blessing, because all of us have had to dig deep down. We've had to get more in touch with ourselves and in touch with each other, and find new ways. And I think because we are still practicing, especially here in Harlem and in New York City, most people really are wearing their masks. They are conscious about social distancing. They are still washing their groceries. They know what happened at the beginning of COVID, and we don't want to see that death and destruction again. And we don't want to see it. We're still looking at it. So I think that we're doing a great job, and we have to keep doing it. And it's allowing us to be more connected and also to be appreciative when in fact we do go out to a gathering and we social distance, or we're so moved, because that's not something we're doing on a regular. We're really beginning to appreciate ourselves and our community more. So this is Harlem Network News, and we're coming to you live, and we are reaching out for support to spread the word, because this is very powerful information that we're coming on with. And we want as many people to be knowledge-based. And if you have any suggestions or initiatives, because each group has to be reached in a different manner. And I had Dr. Agby just speak about what they're doing with this art tech or tech, because it's very key, because this is a population, and a lot of our children, for one reason or the other, have fallen into the IEP population. And a lot of people have just, in the regular system, have pushed them to the side. But look at the brilliance that we're finding. And I think it has to do with when you connect, you find the brilliance. Just like you said, Reverend Al Taylor, when you go to the corner and you start talking to the people, you find the connection, you find the brilliance. So it's about finding that way and that path. And we're going to continue to do the work, and we will see you during the week. And we thank all of you for the great work that you're doing. And I certainly am getting informed on this and on everything. So it's great. And there's more great work that's going on. Community Board 10 has a special committee, and we're working with the Exonerated Five to build a monument in the park. We need support for that. But yes, we can. We know that we can do it, and we'll be looking for educators, because it's going to have an educational component. We're looking for artists, so it's another way that we can really come together and just do the best that we can. So it's a great time to be alive. So Terri Wisdom, Harlem Network News. Please go to harlemnetworknews.com. Please contribute, donate articles. And on that note, we're going to say good evening. And I want to give a special salute to some of our recent ancestors that have passed on. Oliver Gray, that is was second in command to the DC 37, also to Barbara Wisdom from the Bronx, who is also a relative, the grandmother of son. You know, people are leaving in different ways, but as they're leaving a legacy and they're leaving a message. And that is what is important, the legacy. So, Harlem Network News, Terri Wisdom, thank you so much for joining us. Have a great day.
Thank you
Thank
so
you.
much.
Thank you.
Thank
Samuel.
you.
Bye-bye.
Thank you.
Bye-bye.
Have a great day.
Good night.
Bye-bye.